Hi there, welcome back to my channel. What I'd like to do is look at what does healthcare coverage mean in the U.S. And I'm angry, and you should be angry too to what's happening with healthcare. I've had medical care coverage for me all my life. I never gave it any thought to what my benefits were going on as a child until I was an adult. I was covered as a military brat until I entered the Army, and then long after I retired. Well, it's like all those years, and that I never gave it to any thought. Oh, okay. Why my parents in the military? Does that really do anything for me? Or after I'm in the military, well, why should I stay? Because healthcare. That is something. It's important. And even today, I have two healthcare insurances to even cover me. And that's the VA, that's totally free, and TRICARE, which I pay a little bit each month out of my retirement check to cover that, and that's really good. And I've started going to Guam to really get the best of both worlds out of this, because I can go to the Naval Hospital or I go to the VA clinic, and if one can't cover me, I go to the other. And it's really great. I'll give you an example. I'm a type 2 diabetic. The test strips and lancets I can't get through the VA, so I end up going over to TRICARE, and boom, voila! I go to the pharmacy, walk out with my stuff. Other folks probably have to pay a lot more for that kind of service, but I get a lot of things that are just really nice to have through both of those. And even with that, I've got coverage here in the Philippines through the foreign medical program. And I get some types of stuff like my patches, which are made in Japan, which are really good. I can't get those in Guam either. And I can get my pain management covered here free through that, which I can't get anything in the United States, in Guam. I mean, just can't. I mean, it's just a lot of things. It's just incredible how it's not provided, and with everything I have, it's just incredible. I love it, to be honest, and so I'm not going to knock any of it. But for those that don't have what I have, it could be a lot worse, and I feel for you. Give you an example where I live here in the Philippines. The healthcare system locally. A lot of stuff is cheap. Going to the dentist, dirt cheap. I found that out even going to Mexico over the border at the time, back in the 90s, it was dirt cheap. Here in the Philippines, your public hospitals and stuff are okay. I go to a little higher level type 2 hospital. I sometimes have to pay for some things, but not normally. With the foreign medical program, I get covered to go get an MRI done, or X-rays, or anything else, or seeing another doctor. I can walk in, and so it's really good. I love it. So in reality, it's just the most awesome thing in the world. But again, look what's happening with healthcare. The ACA. The Affordable Care Act is going downhill. As of today, the health insurance subsidies that were going on since the pandemic have expired, and Congress hasn't done anything, and probably won't do anything for a long time. So it means a lot of folks are going to have to be paying a lot higher premiums and stuff, and hundreds, if not a couple $1,000s. So for those that don't have high-paying jobs, that could be very scary. I mean, let's get back a little bit of the history here. I was looking at during the 18th, 19th century. Kind of give me an idea. You remember some movies like Django Unchained, where you see the dentist was roving around giving care to folks, or you have someone touting some elixirs as a way to cure all your ills and stuff. I mean, that's healthcare during that time was a hit or miss, and you had to do a lot of stuff on your own. I personally today, I go biking, first aid kit. I got a big one to cover everything I can do first aid on myself in case of an injury. at my home. I got a huge first aid kit to cover a lot of stuff. And then if anybody gets hurt that needs my help, I will come try to help them out too. Now, looking at what's happened after that period, the 18th, 19th century, go up to World War II, which was a big impact on what happened to healthcare and the big changes. There was something called the Stabilization Act of 1942. The consequences of the late stabilization under the act was employers were unable to get were unable to provide higher salaries to attract and retain employees, began to offer insurance plans, including healthcare packages, as a fringe benefit, thereby beginning the practice of employer-sponsored healthcare. So World War II is the big initiative doing that. And then after World War II, they had the Hill-Burton Act, which provided federal funding for hospital construction, and Medicaid and Medicare were established in 1965 to provide health care coverage to the elderly and low-income populations, respectively. So all this happened over decades until what we have today. And of course, you got the affordable health care. Back in 2010 or 2009, I remember, before the Affordable Health Care Act was passed, their opponents were saying, "Oh, you're going to have death panels," which is funny, to determine if you're going to be eligible for health care. And we used to make a joke, "Hey, you're going to be on my death panel. I can make a decision on you." But no one talks about that today. I mean, it's scaring people away. Everybody likes it, but no one wants to help pay for it. But I don't care if you're a liberal or a conservative. Healthcare should be universal. It shouldn't be depending on what side of the fence you're on. And from my perspective, that's where it should be at, taking care of people's lives. And especially with the ACA covering these illnesses that are so catastrophic that you're able at least to have a chance to stay on without draining your health care. A friend of mine, he was Greek and didn't have any of this health care. Unfortunately, he died of cancer, and we couldn't do anything. But he drained all his finances just to get that to happen, to save his life, and he left his family with nothing. Like here in the Philippines, there isn't anything like a hospice. If you get cancer, you're done. I mean, that's where here families are everything, and it is really strong families that take care of people, and a lot of people just can't afford to pay for someone in the family that has no job or income of any type to keep them sustainable. And so they basically, a lot of doctors try to give them their end-of-life care through whatever they can. Even that, I've seen diabetics here rationing their medication or not even taking it at all because they can't afford it. So it's really hard on people not to have any health care, where we need to look at getting to some point of a universal health care system. And I really don't advocate what has happened, but we've got healthcare CEOs and other providers out there getting assaulted or shot and killed over this, and I think we need to get beyond that as being as a option. We need to really push that our folks in government, Congress, really get something done. And if they don't get anything done, as far as I'm concerned, vote them out of office. They need to go. And that's really something that's really painful in my heart, that we've got members of Congress that have all the health care benefits in the world, and the constituents that they're supposed to claim to help don't have anything. And it really hurts. And I hope you understand that. I mean, I feel for those families that don't have anything. So we really need everybody to get together and get out to vote. Do something. Because if those people are not doing it, get them out of office. I'm telling you, it's just not the right way to treat people. And it's really something. I'm sorry to be emotional about this, but I've seen too many people die. And it doesn't need to happen. And we need to get somewhere. So I appreciate what some people in the political side of the world have done, but we're not getting there anytime soon. We're losing doctors left and right, and if we can't keep them, and especially nurses here in the United States, we're really going to hurt our medical system. It's going to collapse on us. And I think everybody needs to stand up and say something, because right now you look at on any news channel, no one's talking about healthcare until it comes up as an issue in Congress. We need to have our, the ground roots of our just people banding together and just saying, hey, let's go make a push on Congress and get something done, because it's got to happen. And really, with prescription drug prices going out of control, I can't believe it. I get my prescriptions for free, and it's not fair. I mean, it's really not fair out there. And we need to start looking at what happens before our whole system just collapses on us. And it's got to be that everybody looks at doing something. Don't sit there. Say something. Let's do something. That's my point I made in my first video. I'm tired of just sitting around and not doing anything. At least, if anything, I've started this channel and I want to do something to get there. And if anything, please don't forget to subscribe as my other videos start to come out and on these other topics. And there's so many things out there to reach out and touch on that are hot issues in the United States. It's not stopping. We need to make a change. And change doesn't happen at the top. Change happens with us across the board as a country. God bless America, and thank you.